Funding for the Nash Villager podcast comes from the Hal Allen Clinic, specializing in minimally invasive robotic spine surgery and laser brain tumor surgery. For 40 years, the neurosurgeons of the Hal Allen Clinic have been national leaders in brain and spine surgery.
Nashville Public Radio serves Middle Tennessee in many ways every day, including through this podcast. You can support it by leaving a review or rating, by telling a friend about it, or by contributing at WPLN.org/give.
This is the Nash Villager Podcast. It's August 18th, 2025. On this day, every year, Tennessee marks Febb Burn Day and the right of women to vote. The Febb is Phoebe Burn, the Tennessean who is credited with an absolutely legendary role in helping ratify the 19th Amendment in 1920. I'm Tony Gonzalez, in for Nina Cardona with today's latest news headlines, an in-depth feature from our WPLN newsroom, and an On This Day mini-essay to give you context for it all. The story of Febb Burn has been often told. I even questioned whether to highlight it. But you know, there are a lot of transplants to Tennessee, and it's a tale worth making sure that we all share in. It goes like this. On this day, in 1920, the Tennessee legislature seemed poised to reject the 19th Amendment. Even one vote could make a difference. Enter Febb Burn. She was a teacher and the manager of a farm and hosiery mill who had 4 children. Her eldest son, Harry, became a state lawmaker, and he was the recipient of one powerful letter from his mother. He had been publicly a no on women's suffrage, but the letter urged him to vote in favor. "Don't keep them in doubt," she wrote, along with, "Don't forget to be a good boy." With his decisive vote, Tennessee became the ratifying state. Now, nearly 100 years later, our state's recent track record on voting is a bit less glowing. Turnout tends to rank low in the nation, and Tennessee has been found to have one of, if not the highest rate of disenfranchised voters. This is largely because of stringent rules about felony criminal records and the difficult steps needed to restore voting rights after serving time. Tennessee has also been part of a wave of Republican-led states that have tightened up rules on how nonprofits conduct voter registration drives. Because of a recent congressional resignation, part of our region finds itself in a competitive election year. House District 7 just had 11 Republicans, 4 Democrats, and 4 independents enter that race. The voter registration deadline for that primary is less than a month away. September 8th is that date. That final contest will be decided in December. Now, Febb Burn seems like the kind of person who could be lost to history. It wasn't her name on that legislative vote in 1920. But the opposite is true. The nonprofit Suffrage Coalition makes a big deal for Febb Burn with an annual fundraising banquet in Knoxville. Tonight's event is sold out. And the group has funded not one, but 2 women's suffrage memorials in downtown Knoxville. And the most recent one features Febb and son Harry together. Fun fact, that monument was made by famed local sculptor Alan LaQuire, who has a real penchant for honoring Tennessee heroes. And Febb Burn certainly is a hero, so we remember her with Febb Burn Day. Tell a friend you heard about it on the Nash Villager podcast and help keep the story alive. In just a few minutes, how are funding cuts impacting national parks like Mammoth Cave and the Great Smokies? That's coming up after the newscast.
Funding for the Nash Villager podcast comes from the Hal Allen Clinic, specializing in minimally invasive robotic spine surgery and laser brain tumor surgery. For 40 years, the neurosurgeons of the Hal Allen Clinic have been national leaders in brain and spine surgery.
You know how important WPLN News has been to you and your family, and you have seen how high-quality local journalism is necessary to a thriving community. You can ensure that this service stays strong and stays available to all of Nashville and Middle Tennessee. Join the Producers Circle with your gift of $100 or more each month and make the bold statement that you support the mission of a more informed and engaged community. Start your philanthropic journey with Nashville Public Radio today at WPLN.org.
For WPLN News in Nashville, I'm Tony Gonzalez. A bull riding event at Bridgestone Arena faced backlash this weekend over one of its sponsors, the U.S. Border Patrol. The Federal Immigration Agency has been a longtime sponsor of the professional bull riders, giving upward of $10 million annually. Bull rider Shorty Gorham has been on several ride-alongs with the Border Patrol. In 2020, Gorham posted a dispatch on Instagram from his ride on horseback with federal agents near the Texas-Mexico border.
We just got word right now over the radio that there is a group that's moving through the area right now, and so we're moving that way. We're going to try to get you guys in on an actual, real-life scenario.
The sponsorship has drawn criticism from immigrant advocates in Nashville. At the same time, local faith leaders rallied at Richland Park yesterday to voice their support for the city's immigrants. Anna Fahrenholt, a member of the nonprofit Nashville Organized for Action and Hope, helped put the event together. She says the level of turnout gives her hope.
It's invigorating, actually. It's so comforting to know that so many people care.
Leaders of the event say that people deserve to feel safe in their homes, regardless of their immigration status. Multiple families lost their homes, and one firefighter was injured in a massive blaze at a Bellevue apartment complex. That was one of two large fires in Nashville that kept crews busy this weekend, battling flames and extreme high temperatures. Saturday morning, 12 units in the Slate Apartments on Highway 70 South were engulfed, and more than a dozen fire engines responded. The Tennessean reports that the initial call came in as an appliance fire. No residents were injured, but one firefighter was taken to a hospital with minor injuries. Others dealt with heat exhaustion. Metro Councilmember Sherry Weiner, who represents Bellevue, has set up a Facebook page with information on how to help residents affected by the fire. Also on Saturday, crews responded to a large barn fire on Licton Pike. No injuries there, but fire crews were rotated while battling the blaze to avoid heat exhaustion. Governor Bill Lee doesn't want low-income Tennesseans to buy junk food with government assistance. WSMV was the first to report. Lee is asking to change the state's Supplemental Nutrition Assistance Program, cutting access to sugary and processed foods. 6 other states, including West Virginia, have already made this move. Health and Human Services Secretary Robert F. Kennedy Jr. heaped praise on them earlier this month. WPLN health reporter Catherine Sweeney tells us why.
Conservatives have long pushed for restrictions on SNAP, otherwise known as EBT or food stamps. The idea being that taxpayers shouldn't foot the bill for luxuries. But as the Make America Healthy Again movement gains ground with conservatives, there's another reason for the push. RFK Jr. notes junk foods like sugary drinks and candy contribute to chronic diseases like diabetes. At the same time, RFK's department has defunded diabetes research within the National Institutes of Health, and Congress passed a package that will cut $1 trillion for Medicaid programs like TennCare over a decade. That program covers about $300 million in diabetes care for Tennesseans annually, according to state data, and the state ranks among the 5 worst in the nation for diabetes prevalence. Catherine Sweeney, WPLN News.
A report commissioned by congressional Democrats about the impact of the Big Beautiful Bill claims that 9 hospitals in Tennessee could close because of cuts to Medicare, Medicaid, and the Affordable Care Act. Those hospitals include campuses owned by Ascension St. Thomas and Vanderbilt. Both institutions tell the Tennessean that there are no plans to close their satellite locations. And one hospital chief says reports like these are often made on incomplete, outdated information by people who have never visited the community. The St. Thomas facilities are in Smithville, Woodbury, and Sparta. Vanderbilt's Lebanon Hospital also made the list. Tennessee has been a hotbed for rural hospital closures. The Sheps Center at UNC Chapel Hill, which authored the recent report about threats of closure, reports 13 rural hospitals have closed in Tennessee in the last 20 years. The analysis on impacts from the Big Beautiful Bill flagged any hospital that already had negative margins for 3 consecutive years. The Trump administration's One Big Beautiful Bill will bring changes for Tennessee students from kindergarten to college. WPLN's Camelia Burris reports on how the legislation will impact the state's most vulnerable kids in surprising ways.
On July 4th, Trump signed a controversial bill into law. It imposes a host of new obligations on the shrinking U.S. Department of Education. These changes include cuts to government assistance programs like Medicaid, which is a funding source for K-12 schools.
Many school districts across the state use Medicaid dollars to provide services for students with disabilities.
That's Jenny McFerrin, Assistant Director of Policy and Research at EdTrust Tennessee. The Big Beautiful Bill will also decrease the number of people who receive SNAP benefits. SNAP is a supplemental nutrition assistance program. McFerrin says that participation in SNAP helps schools determine how many kids are living in poverty and need additional resources.
Some districts identify students for free and reduced price lunch based on whether they're participating in SNAP or TennCare.
Cuts to SNAP, she says, will mean that many Tennessee kids won't get the help that they need.
We're still going to have students who are living in poverty who are now not going to be identified as economically disadvantaged, and their schools are not going to get additional resources to serve those students.
And of course, cuts to Medicaid and SNAP won't just present problems for schools. McFerrin also says these programs make up a relatively large portion of Tennessee's state budget. She says these cuts will really start to hit in coming years, and the state will have to make some hard decisions about how to balance the budget. Camelia Burris, WPLN News.
The ACLU of Tennessee is asking a rural town in West Tennessee to stop its plans to house an immigration detention center. The ACLU alleges that the town of Mason violated its own charter when it approved a contract with the private prison company CoreCivic and U.S. Immigration and Customs Enforcement. Last week, Mason's board of mayor and aldermen voted 3-2 in favor of the contract, with 2 members abstaining. Mayor Eddie Noman advocated in favor of reopening an old CoreCivic facility that has sat empty in the town for the last 4 years. He says the contract will help with the city's finances.
If we say no today, you know what happened? ICE, you're going to find another facility.
The town's charter requires a majority of the members present for votes. The ACLU argues that because 7 members were there, the contract needed 4 votes to pass. In a letter to the town of Mason, the ACLU is asking for local officials to stop all activities with ICE and CoreCivic and to provide a written response. You'll find more news anytime at WPLN.org. The Trump administration has cut staff by more than 24% at the National Park Service since January. Republicans in Congress are now proposing another round of cuts as part of a budget bill. Derek Parham, with member station WKYU, reports visitors are feeling the impacts nationwide and at home in parks like Mammoth Cave and Great Smoky Mountains.
It's the height of visitor season at Mammoth Cave National Park in southern Kentucky. Parking lots are full and cars line the roadways. Visitors are clamoring for spots on underground tours of the longest cave system in the world.
Attention Mammoth Cave guests.
I've got a spot on the popular historic tour, along with more than 100 other visitors, including Mike Johnson from Asheville, North Carolina. He says he's worried about ongoing threats to the Park Service.
They've just been around for so long, and it just seemed like, okay, cool, yeah, no, like that's a national park that's not going anywhere. And now it's like, okay. Things could change.
Through cuts made by the Trump administration and Elon Musk's Doge orders earlier in the year, almost a quarter of permanent staff at national parks has been eliminated since January.
This is the worst I've seen in 53 years.
That's Phil Francis. He's the chair of the Coalition to Protect America's National Parks and worked at the Park Service for more than 40 years, including as superintendent of Great Smoky Mountains National Park. He says those cuts largely impact important behind-the-scenes work, like rescue operations at parks like Mammoth Cave and the Smokies.
When I worked in the Smokies, we would have over 3,000 incidents a year. People would get lost. People would get injured.
He says that when park positions are eliminated, staff in park maintenance, emergency response, and scientific research go first.
There's no secret funding. So if you cut the budget, you're going to lose people, period.
He says the coalition has to rely on historical data to figure out what's going on behind the scenes, largely because since January, communication with the parks has been cut off.
And it's very difficult to find anyone who, off the record, will tell us the story.
2 rangers lead our group on the 2-mile trek through the tight twists and turns of the underground cave. In our safety briefing, our lead ranger told us that he's seen an increase in medical evacuations out of the cave.
I can tell you from experience, folks, that medical evacuation out of the cave will, and has taken typically about 6 hours to carry out.
Park advocates say staffing cuts reduce the resources needed for those rescues. As my group navigated the twists and turns of Mammoth Cave, squeezing through spaces single file and shimmying through tight passageways, the reality of a potential rescue mission set in. So why make those cuts if it means putting people at risk? Here's what Interior Secretary Doug Burgum told a Senate committee in July.
I believe that we can reduce what we spend in overhead in the park and have more people actually working in the parks.
Ebony Preston Goddard oversees the Southeast region for the National Parks Conservation Association. She says every cent spent on the Park Service is worth it in the long run.
The National Park Service represents 1/15 of 1% of the federal budget. And then what we've seen for every dollar that's been invested, we've seen at least $15 returned within that local community.
That local economic impact stands out for parks like Mammoth Cave, which has seen increasingly record-breaking attendance in recent years, and for the Smokies, which is the most visited national park in the country, with more than 12 million park-goers in 2024 and an economic output of more than $3.4 billion in 2023. With large, financially successful parks at risk, Goddard worries for smaller sites in Appalachia with less notoriety, like the Cumberland Gap, the Appalachian Trail, Pisgah National Forest, and the Blue Ridge Parkway. I'm Derek Parham in Bowling Green.
This story was produced as part of the Appalachia and Mid-South Newsroom. That's a collaboration between NPR and several public radio stations in West Virginia, Kentucky, and Tennessee, including WPLN. Thanks for listening to the Nash Villager podcast. We look into the Nashville news every weekday. If you like this show, please go ahead and subscribe in your podcasting app. And think about telling a friend or give us a mention on social media to help get the word out. You can also support the podcast directly with a donation at WPLN.org. And that's it for today. Thanks so much for listening.
Funding for the Nash Villager podcast comes from the Hal Allen Clinic, specializing in minimally invasive robotic spine surgery and laser brain tumor surgery. For 40 years, the neurosurgeons of the Hal Allen Clinic have been national leaders in brain and spine surgery.